residential gatherings to your household only, with exceptions for essential services. Limiting retail operations with new capacity limits, and ensuring that only essential items are purchased in person. And providing clarity on what is deemed to be an essential item. I'll now pass it over to Dr. Roussin to provide his daily COVID update and to expand further on these new measures. Brent, over to you.
Thank you, Premier. Good afternoon. Today we are announcing 8 additional deaths due to COVID-19. A male in his 60s from the Winnipeg region, linked to the outbreak at the Kikinin Center. A male in his 70s in the Winnipeg region, linked to the Maples long-term care home. A male in his 70s from Southern Health Santé Sud, linked to the Rest Haven nursing home. A female in her 80s from the Winnipeg region, linked to an outbreak at Maples long-term care. A male in his 80s from Southern Health Santé Sud, linked to an outbreak at Rest Haven nursing home. A female in her 90s from Winnipeg, linked to Maples long-term care home. A male in his 90s from Prairie Mountain Health region, linked to Gilbert Plains personal care home. A female in her 90s from Prairie Mountain Health, linked to Gilbert Plains. I'd like to extend my condolences to their families and loved ones. Our current 5-day COVID test positivity rate is 14% provincially, 13.7% in Winnipeg. We have 475 new cases of the virus identified as of 9:30 a.m., bringing our total to 12,482. Today we're announcing updated public health orders that will come into effect November 20. The orders will further limit social contacts and the operation of non-essential businesses. Last week, we introduced the strictest public health orders we have had, throughout this pandemic. We've pleaded with Manitobans to stay home, to protect themselves, protect their loved ones, protect the community. We advised strongly to only go to the store for absolute essentials. We pleaded with people to think about our healthcare providers that are at risk and how hospital capacity is becoming stretched. Despite that, we saw people gathering at rallies. We saw crowded parking lots at big box stores. We saw people continue to go out for non-essential items. So we're left with no choice but to announce further measures to protect Manitobans, to limit the spread of this virus. The new orders will state no one is permitted into a private residence or property other than those who live there, with a few exceptions for essential reasons such as childcare, healthcare, and emergencies. This includes your home, cottage, or other vacation property. If someone lives alone, they can have one other person into their residence, and they may visit that person's home as well. Gatherings of more than 5 people at any indoor and outdoor public place continue to be prohibited, of course with the exception of a healthcare facility, school, or critical businesses that are following the orders. Because the orders are strict, there's not really many indoor places where people can gather anymore. But it does allow instances such as weddings, funerals, other gatherings such as baptisms to take place, but that capacity limit is 5. We know there are significant physical and mental health benefits from being outside, staying active. The risk of contracting the virus is much lower outdoors. But even when observing the 5-person gathering limits for these specific situations, keep following basic public health advice, the fundamentals. We know there are many retailers out there that have been doing good work right from the beginning. They're following the orders, monitoring capacity, making the changes based on public health advice. But we saw others that were encouraging people to line up for Black Friday sales, selling non-essential items, trying to work around the orders. And so right now, it's clear we need to reduce our contacts. We need to reduce prolonged close contact, especially indoors. And the best way to achieve that is to stay home. Stay home, don't socialize with people outside your household, and leave for essential reasons only.